So when we talk about mental health in reference to men, men experience mental health condition at a very high rate, just like women. However, they are far less likely to seek help. Why? Because our cultural expectation is that men must be tough and they must be strong. However, this stigma is literally costing lives. Men account for approximately 75% of suicides in many countries. They are far less likely to seek mental health assistance compared to women. And depression in men is frequently misdiagnosed or it goes undetected. So sometimes a patient, a male, may seek help through alcohol and substance misuse, okay? And this is like a coping mechanism for them. So for men, depression may look a little bit different. Like for instance, when they have sadness, they may demonstrate it by showing anger, irritability, and aggression. Withdrawal, so they may withdraw from their family, from social situations they normally would enjoy. And by doing that, you may find they overwork themselves or they do excessive exercising. Even when they feel hopelessness, they may have risk-taking behavior and recklessness. Fatigue, so they may have chronic physical complaints. And loss of interest, they may experience loss of interest, and they may have feelings of emotional numbness and detachment. So what our men or brothers need to hear is that seeking help is actually an act of courage, not weakness. Your family needs you to be mentally present, not just physically present. And seeking mental health can prevent you from losing opportunities. It can prevent you from losing your marriage, can prevent you from losing your job at times, and even your life, because people sometimes with mental patients or in mental health situation could have thoughts of suicide. Okay, so next slide please. So in this discussion, we are not really going to go into too much of different types of mental health conditions. We are not really doing any diagnoses at this point in time. We are just basically doing an introduction into the topic of mental health. So let's do a case study, right? Mr. Marcus, he is 45 years old and he has been running his business for 15 years. After financial pressures and his father's death, he became increasingly withdrawn, irritable, and started drinking heavily every evening. His wife noticed that he stopped laughing and rarely slept. He insisted he was just tired from work. So what went wrong is that Mr. Marcus waited 18 months before seeking help. He visited his GP or his doctor for insomnia, which is problems to sleep, and he didn't mention the alcohol or the crying that he did privately, or thoughts that his family would be better off without him. What changed is that his GP, his doctor, screened him for depression, and he scored very high, indicating that he was severely depressed. He was referred to a psychiatrist, he was started on antidepressant medications, and his alcohol use was addressed. So the outcome is that Mr. Marcus is now in remission, and he credits the therapy for saving his marriage and his life. So the most dangerous words in a man's vocabulary is when he is not well saying, "I am fine." Okay, because they're feeling that you need to be strong all the time, you cannot show weakness, and this type of expectation from our men that, they shouldn't be having any mental health issues, okay? So real strength is knowing when to ask for help, and your life matters and your mind matters as well. So just as physically, we will seek help when we have a medical condition, Similarly, mentally, if someone is experiencing symptoms, they need to seek help, and sometimes we may recognize it in our relatives or co-workers or colleagues or neighbors or someone, and we may notice different changes, which we will discuss later on in the other slides, and it's a very good idea for us to address it with them with kindness and being non-judgmental. Next slide, please. So when it comes to women faces unique challenges, okay, when it comes to mental health conditions. And it is shaped by biology, social roles, trauma exposure, and systematic inequality. So concerning depression, women are twice as likely as men to experience clinical depression. Anxiety disorders are more prevalent among women. Postpartum depression affects 1 in 7 new mommies or mothers. So postpartum basically means after giving birth, right? After having a baby. So that particular depression is the statistics show 1 in 7 new mothers, but is often unrecognized. Eating disorders like anorexia and so on mostly affects girls and women. And PTSD, post-traumatic stress disorder from domestic violence, sexual assaults, and childhood trauma, women face higher rates. Now, saying this, it doesn't mean that men don't have these as well, okay? It's just that women have higher rates of it. So warning signs too often dismissed by women are, people might say to a woman, you just hormonal, you're PMSing, right? So sometimes by doing this, we trivialize the mental health or the mental illness that the person is having. Or you need to be strong for your children. Okay, so sometimes we encourage them to suppress their grief and whatever burnout they may be experiencing. So persistent exhaustion, sometimes people might say, she's just too lazy, and it may be that the person is actually going through a depression. All right, and sometimes anxiety is often dismissed as overthinking rather than the person actually having a medical condition that is treatable. So what our women and sisters should understand is that you cannot pour from an empty cup. All right, so your mental health is not a luxury. It is very important, and it is an integral part of you. Okay. Postpartum depression, so this is depression after having a baby, is not a failure as a mother. It doesn't mean that you are a failure if you're having these symptoms after having a baby. It is actually a medical condition. Domestic violence can lead to lasting psychological trauma, and it can require professional support. And it is safe to tell your doctor about your mood changes, anxiety, and emotional struggles. Next slide, please. So let's review a case of Miss Shania, who is 28 years old and a new mommy. So Shania had a healthy baby girl. By week 3 postpartum, she's not sleeping. She felt no bond with her baby, was crying unconditionally, and had thoughts that she was a terrible mother. She told no one for 6 weeks out of shame and fear of having her baby taken away. What went wrong is that her postpartum depression was not recognized early. She minimized her symptoms when she was asked how you are managing. What changed, however, is that her mother noticed the signs and brought her to her doctor. All right, and she was diagnosed with postpartum depression and started on treatment. And Shania recovered fully within 4 months. So what we have to understand is that sometimes it takes a relative who might recognize the symptoms in the patient. The patient might understand and recognize it within themselves, but shame and fear of being judged, and for instance, in Shania's case, she was thinking that she's a terrible mother, and she was even afraid if she expressed these thoughts that her baby will be taken away from her. And what helped the situation is that her mother recognized that things were not so right. She recognized certain symptoms in Shania. She spoke to her about it, and she took her to her doctor to be seen. So next slide, please. So understanding and recognizing may be left on relatives, okay? And when we talk to our relatives about it, we have to be very kind about it and non-judgmental. So when it comes to children and teenagers, mental health conditions frequently begin in children and adolescents, yet is often dismissed as phases. So sometimes people say that's just a phase they're going through, or we say that's the bad behavior, teenage drama, and we like to use the word harden. They just harden, you know. However, what the data tells us is that suicide is a leading cause of death amongst adolescents age 15 to 19 globally. All right, and children exposed to adverse childhood experiences like abuse, neglect, violence are at significantly higher risk of mental health illnesses. So some warning signs we could look out when it comes to children from ages 5 to 12 is, for instance, persistent sadness, crying, or withdrawal from friends and family. Sudden changes in school performance or refusal to attend school. So they were doing good before and then all of a sudden their grades drop dramatically. Regression, so for instance, bedwetting or thumb sucking in a child who had outgrown these behaviors. So at one point in time, they had stopped bedwetting, stopped sucking the thumb, and then after a period of time, they start back doing it. Okay? Excessive fear, nightmares, or separation anxiety beyond what is age appropriate. Yes, we know small children have some anxiety when being separated from parents and they may cry, but we're talking about something that is age appropriate. So bigger children who you would expect to go to school and be okay, you know, having separation anxiety. Talk of death, hopelessness, or wanting to disappear. So those are some warning signs in younger children. When we come to adolescents, ages 13 to 18, some warning signs are dramatic withdrawal from activities which they previously enjoyed. So things that they used to like to do, all of a sudden, they're not showing that interest anymore. Persistent low mood, irritability, or emotional flatness for more than 2 weeks. Changes in eating or sleeping behavior. So all of a sudden they're eating plenty more or way less. Or where the sleeping pattern is sleeping much less or sleeping plenty more. Okay, so basically in one of the extremes, which is different or not their habit. Self-harm or cutting or talk of suicide. This one especially we want to always take seriously. We will discuss a case just now about it, okay? Substance use like alcohol, marijuana, or other drugs that they take for self-medications which are not their medications. And excessive screen time combined with social withdrawal. So these are warning signs in adolescents that we have to pay attention to. When it comes to what could parents and caregivers do, number one, we want to listen without judgment. Don't say to somebody that you don't pray enough, you're not religious enough, you're not strong enough, okay? We don't want to dismiss or minimize what it is. When we ask them about it, we want to show concern, we want to show love, we want to show care, but we don't want to minimize what they say to us, okay? We want to avoid punishing emotional expressions, or basically we want to create a safe space at home. So for instance, let's say we ask a child, what's going on, what's happening, I notice things different, you know, with you, what's going on, and they start to tell us, and we like, after all I do for you, you're so ungrateful, I sending you to school and I just work so hard. You know, sometimes we may get sidetracked. You don't want to do these types of things, because if you do this now, the child will shut down and they wouldn't want to share what their experiences and what they are going through. Now, bear in mind that we have a bit of a generation gap, okay? When we were younger and our parents were younger and their parents were younger, the generations were different. What they were exposed to were quite different, you know. Sometimes when we talk to parents about certain things, they will say, well, you were lucky because in our time we used to go to school without slippers, which is true. those things that happen, but alhamdulillah, now most of the times now everybody have shoes and sneakers to go to school for. So you don't want to use the opportunity when a child is going through a crisis to now sort of like minimize what they're saying. You know, we want to listen with empathy and validate, well, we understand what's happening with you, and now try to seek, well, how we could help this child. Okay, so we want to seek help for them. You could take them to the doctor, any health center, any clinic. If it sounds like an emergency, like a crisis right now, you could take them to the emergency department. In a few slides later on, we'll talk about what are some crisis situations. All right. And if there are counselors in the school and you could get those services for the child as well, we want to engage those services. Next slide, please. So let's discuss this case about Jaden, who is 13 years old and he's a secondary student. Okay, Jaden's grade dropped sharply when he was in Form 2. He stopped playing football, rarely spoke at home, and spent hours in his room. His parents attributed it to a teenage attitude. He had started cutting his wrists, which he hid under long sleeves. So the self-harm went undetected for 5 months. No one asked Jaden directly how he was feeling. He was actually scolded for his grades, which increased his shame and isolation. However, one of Jaden's teachers noticed that he was wearing long sleeves in the heat and gently spoke with him. She referred him to the school counselor, who involved his parents and recommended urgent psychiatric assessment. Jaden was diagnosed with major depressive disorder. With therapy, family support, and a safety plan, he has not self-harmed for 14 months. So what we have to recognize is that, especially when it comes to children, sometimes they don't even understand for themselves what is happening with themselves. Okay, so when we approach them and we seek help for them, it's a long-term relationship and it's a long-term care that they will need care and support that the children or anybody struggling with mental health illnesses will need. So if your child say that they are struggling, it is up to us. We need to believe them. The greatest gift we could give to the child is giving them basically an understanding that they can always come to us, they can always be open to us. We will not judge them, but we will help them to find solutions to whatever problems and situations they may be going through. Next slide, please. So basically, just to sum up the previous slides that we had done, mental illness did not discriminate by gender, age, or social status, and what made the difference for the cases that we had discussed before was honest conversation and seeking help. So from here on, we want to discuss about recognizing mental health crises. So a mental health crisis is actually a medical emergency. It deserves the same urgent and emergency care and response, just like someone having a heart attack or a severe injury. Somebody who is going through a mental health crisis, you don't want to leave this person alone, and we do not want to ignore warning signs. So some warning signs about suicidal crisis. Particularly now we're referring to suicidal crisis. Of course, there are other mental health crises, but let's talk about suicidal crisis. So what are some signs is that the person may start talking or writing about death, dying, or suicide. Saying things like, I wish I was dead, everyone will be better off without me, or I can't take this anymore. They may start giving away their prized possessions and saying goodbye unexpectedly to others. They may have sudden calmness after a period of severe depression. And this could actually signal because they finally made a decision that they're going to commit suicide. So because of that, they feel a sense of relief, and then they may start giving away their possessions and basically saying goodbye to friends and relatives. So they may start doing research about how to commit suicide and so on, and they may withdraw from social contact and suddenly disengage. So what are some things we should do immediately if we notice these warning signs? Stay calm and stay with the person. Don't leave them alone. If the person is in a crisis, then we want to address it immediately. So ask directly, are you thinking about harming yourself or committing suicide? So a lot of times people tend to think if you ask them directly, this is a sign that we might put the idea in their head. So you might be afraid or thinking that you don't want to ask them because you might be introducing the idea, but actually no. It is better to ask them because if they already have the idea in their head, this is a way for us to recognize and seek help, emergency help for them. Okay, so don't hesitate. You can ask the question directly. Do you plan to commit suicide? Are you thinking about killing yourself? You can actually ask them directly, and it wouldn't be that you causing them to do this. Okay, listen without judgment. Don't minimize it or try to fix it. Remove any access to any means if possible. So any medications, any sharp objects, or any firearm that they can harm themselves or commit suicide with, and call for help. So take them to the nearest emergency department, or even you could call the ambulance if you need to. So mental health can cause people to reach a stage where they become suicidal. And we need to recognize these. You don't want, God forbid, you do not want that a relative or a friend or a colleague who you had noticed symptoms before actually kill themselves, and you feel to yourself, well, I could have helped them, or I could have, I had noticed but I never asked, and then they end up doing this, We want to be able, by actually recognizing and addressing and talking to them, it could actually save their lives. Okay, so certain things not to say, don't say. You have so much to live for because it will invalidate their pain and what they're going through. Don't say, others have it worse, because when we compare them to other people, it could feel harmful to them. We wouldn't want to leave this person alone if we believe that they're in immediate danger, and you don't want to keep this a secret, because getting help is not betraying the person. It is actually like an act of love and care and compassion for this person. Okay, so if anyone looking at this program is in a crisis right now, please tell someone. All right, you could go to your nearest emergency department. You could call someone you trust. You are not a burden. And your mental health is very important. If you go to the emergency department, nothing is wrong with you saying, I'm having these thoughts, these feelings are within me. The medical professionals are trained to understand what these means and be able to help you to get care. Okay, so we will be going for a break right now. Jazakallah, and thank you for allowing us this opportunity, and see you after the break. Assalamu alaikum.
It's Super Mountain Savings! Only at Passad, the Food King. Incredible deals on Santa Rosa Chicken Vienna Sausage, 4 tins, now $20. Golden Brand Margarine Stick, 225 grams, 3-pack, now $20. Guiltless Yum Yogurt, 4 tubs, now $20. More wow deals on Sierra Chicken Franks, 3 packs, $20. Lucozade Energy Drink, 360 ml, 2 bottles, now $20. Fresh Harvest Chana and Brine, 3 tins, now $20. More super savings on Moo low-fat evaporated milk, 250 ml, 4 packs, now $20. Blue Sea Tuna Flakes and Oil, 4 tins, now $20. Cataly Tomato Ketchup, 3 packs, now $20. Sale ends June 7th or while stocks last.
Bushside, quality value, that's our way. The real Bushsides, we're here to stay. The Food King Bushsides.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to IBN's 20th anniversary Doctor in the House. I am Dr. Nadia Brafit Swamad, and our topic today is mental health. So before the break, we were we had discussed that one of the main reasons that people in the Caribbean do not seek medical attention or medical care for mental health issues is because of the stigma attached with mental illness. Next slide, please. So let's discuss about breaking the stigma and seeking help. So most people in the Caribbean don't seek help because they are afraid of being labeled. For instance, sometimes people call them mad, weak, crazy, and a lot of different things I'm sure you can think about when it comes to persons with mental health. So there are different types of stigma. There is social stigma, which is negative attitudes and discrimination from within our own community, workplace, or even our family towards mental health. There could be self-stigma, which is internalized shame, believing you are weak, broken, or less than others for having a mental health condition. There's also cultural stigma, which is religious, traditional, or cultural beliefs that mental health is like a spiritual punishment. For instance, somebody might say to someone who's having a mental health issue or mental illness, you have a jinn on you. Is a jinn causing this to happen to you? Okay? And sometimes by telling someone this, it could actually prevent them from seeking medical care. And even institutional stigma. So for instance, systemic barriers within your employment, in your workplace, you could have disadvantages within any institution that you're working because, you don't want people to think that you have a mental health issues and for them to judge you. So these are stigmas that can actually prevent someone from seeking medical care for mental health issues. Okay? So some of the things you want to consider, you can talk to your general practitioner or your doctors, okay? So let's just say someone is in a crisis. If someone is in a crisis, so they're having thoughts of you are maybe having thoughts of committing suicide or killing yourselves, or you might have thoughts that everybody else would be better off without me, or I am a failure. Thoughts like this, and you have thoughts of committing suicide, you can go to any emergency department, any emergency, and you talk to them, and they will recognize. So emergency hospitals, yes, is for people who are broken, having heart attack, having other situations, but mental health crisis is also an emergency. Okay? So if you or someone you recognize is having this type of crisis, they need immediate assistance. And if you don't have transport, you could actually call an ambulance. All right. So next thing too, another mental health crisis could be if someone is having psychosis. So psychosis or behaving psychotic. So let's say, for instance, you have someone who hearing voices or they're seeing things that other people are not seeing, and they start to behave in an erratic manner. They may behave in a manner that could cause harm to themselves. Or you may see someone walking down the street and they completely take off all their clothes. This is not something that someone who have a normal mental health or normal function in mind will do. Okay, so these are all signs that this person is having a psychotic or unwell mental issue happening. Okay, and these are people who would need help. Okay, so when we recognize this, and if somebody is experiencing psychosis or having mental health crisis, this is when they definitely need emergency care. So you can take them, if they're willing to go with you, to the emergency department. There are treatments to help calm them down while the doctors figure out what's going on and give them long-term care and treatment. Or even you can call the ambulance as well. Now, patients usually, when they are treated for mental health illness, over a period of time, months and so on, they really dramatically improve a lot of times. You will find patients would go in like once a month and get their injections in the health center, and they tend to function much better in their personal lives, in their jobs, and so on. All right, so it's really important. There's a lot of help and resources out there to help people who are going through mental health issues. Okay, so some different types of professionals who can help someone who has a mental health illness is like a psychiatrist. So a psychiatrist is a medical doctor who specializes in mental health. So bear in mind, right? So just like you have cardiologists who are specialized for taking care of the heart and doing surgeries on the heart, you know, you have dermatologists who are specialized for skin care, hair, and so on. We have psychiatrists who are specialized just to take care of mental health. This is how important this is. It is like a field on its own, right? A specialty on its own that we actually have psychologists, okay? And a psychiatrist can actually prescribe medications and provide therapy. Then we have psychologists, okay, who they are specialized in assessment and psychological therapy like counseling and even trauma therapy. There's also something called CBT, cognitive behavioral therapy that these mental health specialists can use for patients, okay? You have counselors, you have therapists, you have social workers. So they are actually trained in these fields as well. And even your general practitioner, your doctor that you visit in the health center, or a doctor right in your community, a general practitioner doctor you can go to, and they can actually screen you to help you recognize, is there a problem? Or what is the diagnosis you may have? And actually, they will actually be able to help recognize, well, how severe? Is it mild, moderate, or severe? Okay, and some cases you may be referred from your GP to other mental health specialists, okay? So there are a range of specialists specially trained in mental health care, okay? So this is to explain that it is actually something, mental health is just as important as physical health in any other part of your body. Okay, so seeking help for your mind is exactly the same as seeking help for any other organ of the body. Okay, a broken bone needs a doctor. A struggling mind also needs a doctor as well. Okay, and there's nothing shameful in seeking help for mental health conditions. Next slide, please. So let's talk about mental wellness and self-care. So building resilience and protecting your mental health before a crisis strikes. Mental wellness is not the absence of struggle. It is actually the presence of tools, habits, and connections that help you to navigate life's choices. So life challenges. So basically what we are saying is that being mentally well is actually because of our things that we actually do, or habits that we have, okay? So just like if staying physically healthy, people do things what they do. They watch the things they eat, they try to decrease salt, you know, to prevent high blood pressure. They try not to eat too much high sugary drinks and foods to prevent diabetes. You know, so physically, people remain healthier by choices and activities and certain things that happen in their life. Similarly, when it comes to mental wellness, we could make an impact to help with our self-care and improvement. That doesn't mean to say so somebody could be doing all the mental wellness things and still be unwell. Similarly, somebody could be making all the efforts they could to stay physically well and still become ill in some situations. So we want to always be aware that what are some things that we can do to help improve or maintain our mental wellness. So let's discuss the list. Okay, so let's talk about physical activity. So 30 minutes of exercise daily, or at least 5 times a week, it could reduce depression and anxiety symptoms significantly. Because why? When we exercise, endorphins are released in our brains, and endorphins is like the happy hormone. All right. Sleep hygiene. You want to have sufficient sleep in the night. Okay. So you want to have a sleep pattern. You want to go to sleep at specific times. You don't want to be waking out whole night, because then your body is not rested, your mind is not rested, and you can't function as you're supposed to. And poor sleep patterns will worsen mental health conditions. In fact, if somebody having chronic poor sleep, you can actually get a mental health. Like, for instance, you could actually have insomnia, all right? because of poor sleep habits. We could actually cause it to ourselves if we consistently stay awake every night. Let's say, for instance, we are on our phones every night until very, very late. You know, we have something in our brain called the circadian cycle that causes us to fall asleep at specific times, right? So our body could function and mind could function. But if every night I say I'm going to be on my phone until 3, 4, 5 in the morning and knock off that circadian cycle and take it out of access or how it's supposed to be functioning for me to automatically fall asleep or to be able to fall asleep easier, and then when this happens now, you don't have a proper sleep cycle, you're not getting sufficient sleep, and then this could make you be chronically tired and could have anxiety and different mental health issues because you're not getting sufficient sleep. So what you want to do is try not to be using your cell phone when you're going to bed, because one of the things it does is that it could stimulate the brain. You understand? And when you want to go to sleep is when you're kind of basically winding down, calming down for sleep, but your brain stimulated because of the light and so on coming from the phone. Okay, so you want to consider putting away the phone so that you could have better sleep. Next thing is nutrition. All right, so a balanced nutrition, all right, a balanced diet can also help us with our mental health, because if someone chronic, like let's just say for instance every day we out and we eating fried foods and so on, you could get high cholesterol, you could have physical medical conditions as well. All right, social connections, so strong relationships are the single greatest protective factor against depression. Where are your siblings? Make a date and go out with your siblings, you know, go on a line, spend some time with them, go visit them or let them visit with you, or go and have lunch with them. What about your friends? You know, a lot of times we get caught up in life, in family, job, we're doing this project, you're doing this assignment, you know, and friends and family, you tend to kind of, they might be less times you're seeing them, okay? And it gets less and less as your responsibilities become more. However, you want to try to maintain a good relationship with friends and family so that this also helps with prevent you from being isolated and help you to be able to cope with daily life challenges. So let's say, for instance, you're struggling with something at work. You may have a co-worker who giving you a difficult time, or a boss, or somebody even, it might be another relative as well, and being able to speak to someone, you know, and getting that support is very important for our mental health. Mindfulness and breathing. So for instance, you may be in situations where you're feeling anxious, you're feeling your heart racing, you know, these types of things, and there are things you could go on the internet and even look to see what are some breathing techniques you can do to help you calm down, to help you feel at ease, to help you be able to cope with the stress of whatever situation you're going through. So, you know, it have this one about the 5, 4, 3, 2, 1. What are 5 things that you... So sometimes you might have thoughts that are just racing in your mind constantly and you have no control over it. And it making you feel anxious, it making you feel frightened, you know. And of course, you know, it have things that you could do to try to modulate or to calm yourself down, right? So one of the things is that you could think of 5 things you could see, right? 5 things you could see, 4 things you could hear, 3 things you could smell, 2 things you could... So you could just look it up online, right? So basically it's like you engage in your senses, and while you're engage in your senses, you name the things, okay? So there are different ones that they have online, different types and so on. It have breathing techniques, it have self-calming techniques as well, that you could actually go and choose one that is you would remember and is easier for you, okay? And also we want to talk about doing things that you feel a sense of purposefulness, so volunteering and things that you like, that could also help you, your self-image and how you feel about yourself. And having relationship with your doctor in the sense that you feel trusted towards this doctor. You build a trust relationship that you can go and you can tell the doctor, look, I'm having symptoms that you may usually not feel you want people to know about, like for instance, you're feeling low mood, you're feeling depressed, you're feeling sad, and sometimes you may not be able to even find a reason for that. Okay, and all of that is okay as well. Next slide, please. So some things that we want to remember, some take-home messages are that number one, your mental health is very important. It deserves the same attention and care as your physical health. You want to create a predictable, emotional, safe home environment as much as you can. You want to validate feelings. For instance, let's say, for instance, you're asking somebody about what's happening with them. You could say things like, it makes sense what's happening, or what you're feeling is understandable. You don't want to dismiss them and say, well, you shouldn't be thinking like this, because you have so much good things going on for you in your life. Things like this you don't want to do, right? You want to limit screen time as much as you could. So sometimes people may be spending 6, 7, 8 hours a day on social media on their phones, okay? Because by doing this now, you decrease the amount of time that you have face-to-face with your relatives, okay? You also want to make sure that you seek help for any medical or mental health situation that you may be going through. Do not feel ashamed. All right, don't let stigma and other people's ignorance, just speaking frankly, prevent you from getting help that you need. Okay, and when we get the mental health help that we need, you can see eventually an improvement in your relationship in your marriage, your relationship with your family members, how you function in work, and so on. All right, so if you are going through any mental health issues, then please seek help. You go to the health center, you could go to the emergency department. If you recognize a relative having mental health issues and symptoms into your homes, Assalamu alaikum wa rahmatullahi wa barakatuh.
The Food King. Incredible deals on Santa Rosa Chicken Vienna Sausage, 4 tins, now $20. Golden Brand Margarine Stick, 225 grams, 3 packs, now $20. Guiltless Yum Yogurt, 4 tubs, now $20. More wow deals on Sierra Chicken Franks, 3 packs, $20. Lucozade Energy Drink, 360 ml, 2 bottles, now $20. Fresh Harvest Chana in Brine, 3 tins, now $20. More super savings on Moo Low Fat Evaporated Milk, 250 ml, 4 packs, now $20. Blue Sea Tuna Flakes and Oil, 4 tins, now $20. Cataly Tomato Ketchup, 3 packs, now $20. Sale ends June 7th or while stocks last.
Bushside, quality value, that's our way. The real Bushsides, we're here to stay. The Food King Bushsides.
But when he said, Fandor, look, think about this. Because he said, I saw in my dream, that I kill you. Fandor mada tara. So look and tell me what you think about this. And that was a way of honoring his son. He didn't have to ask him. It was a way of honoring his son. And that's what Allah is doing here when He's giving us this chance to loan alone, not to Him, but to His deen, to do good deeds, to do these things. يُضَاعَفُ لَهُمْ وَلَهُمْ أَجْرٌ كَرِيمٌ. He will increase them in that loan. In other words, that loan is multiplied, and the metaphor for that in the world is interest, which is interesting why Allah has prohibited interest, because it's as if He is the only one that can do that with loans. Is that's Allah's, nobody else can do that. Make something out of nothing, because that's what interest is. It's making something out of nothing, right? And that's what it is, if you think about it. Because I'm giving you $10, and I'm making from that $10, by the mere fact I'm loaning it to you, $20 or $30. So I've made something out of nothing. I mean, that's the game of usury. So we're being told that Allah increases it, وَلَهُمْ أَجْرٌ كَرِيمٌ, and they have a liberal reward, this generous reward. And this is where the karamat, لَقَدْ كَرَّمْنَا بَنِي آدَمَ, we have honored the children of Adam. This is part of the takreem, and that's why it's ajrun kareem. It's a generous, liberal reward, because Allah's doing out of His generosity. He's not doing it, it's not a fitting reward. Do you see, there's nothing fitting, there's no real parity here. Nothing is equal to Allah. But it's a generous reward because Allah is doing it purely out of this karam, which He's Dhul Jalali wal Ikram. It's part of the nature of Allah subhanahu wa ta'ala to do that. And then, وَالَّذِينَ آمَنُوا بِاللَّهِ وَرُسُلِهِ أُولَٰئِكَ هُمُ الصِّدِّقُونَ. Now look, see the Siddiq. This is those who believe in Allah and His messengers. They are the Siddiqun. So now this is a maqam. The Musaddiqun and the Musaddiqats is a maqam. If you do